We had a great discussion, almost an hour, very productive one with the Prime Minister. The Prime Minister this morning made a public statement, one that we welcome, and that is that no state or territory will be worse off under the Henry tax review. We certainly welcome that from the Prime Minister. We discussed a number of areas in relation to aligning hospital care better with primary care and aged care. Now, what I said to the Prime Minister is what I've been saying all week, and that is New South Wales welcomes this historic opportunity. We're not about putting up barriers to get to an agreement. Rather, we're about identifying the issues and working through them in a spirit of true partnership.
What about the Henry review on tax? Did he give you any more detail on that, or when you might see the detail?
Well, certainly it's the Commonwealth's decision as to when they respond to the Henry tax review and how they respond. For us, being asked to direct 1/3 of our GST to health, we wanted to be certain there weren't other implications we needed to consider from the Henry tax review. Now, the Prime Minister has given his word this morning that no state or territory will be worse off under the tax review, and I'm very pleased about that.
But would you want to see the detail ASAP?
Well, certainly we understand that there's much debate and discussion about the tax system, and when we talk about the review of the tax system, we're talking about something that is as big as reform to the health system. Now, that's a timing issue for the Commonwealth, and certainly there are many issues they need to consider, but we do welcome from him that public commitment.
The Prime Minister on breakfast television this morning was asked about your health system, and he said that it's not flash, quote unquote. So was he a little more diplomatic in your talks with him?
Well, we had a very good discussion about what works well for New South Wales and what needs to improve into the future, and certainly the funding model must improve and the funding model must change. To continue health as we have been, we will consume the entire state budget by around 2046. We did discuss New South Wales' good performance in emergency departments. We're the best performing emergency departments in the country, and more people receive their elective surgery within recommended timeframes in New South Wales than they do anywhere else in the nation.
But surely it's frustrating when he has a go at you on national television, or at least has a go at your government's record.
Well, the Prime Minister has done a tour of the nation, a national consultation. What he's heard is what we have long been arguing, that healthcare delivery and healthcare funding must change. Now, in New South Wales, we do a better job than other jurisdictions, particularly Victoria, in keeping people out of hospital and treating them through the primary care system and through outpatient care. We want to be sure, as we move forward, that the changes to the health system don't increase hospitalization, that in fact we see lowering levels of people entering hospital for their health.
So it doesn't annoy you that the Prime Minister takes his criticism to the airwaves like that?
Well, the Prime Minister and I have a good relationship. We had a good, frank and full discussion today, and one that left me with a great deal of hope that we will be able to reach the historic agreement that's required to deliver this fundamental change to our health system.
Premier, just one last issue before I let you go. The state government reportedly planning a new metropolitan authority to compulsorily acquire privately owned land and rezone that land for development. What are the details here? Is Cabinet close to signing off on this?
Well, first of all, the Sydney Metropolitan Development Authority, a proposal put forward in our Metropolitan Transport Plan, the first time in this city that we have directly integrated land use and transport planning. Now, the Sydney Metropolitan Development Authority is going through a cabinet process. We won't rule anything in or out. We do have a housing shortage in Sydney. It's something we need to address for the future of this city, and the Metropolitan Development Authority will drive that renewal. Now, can I say, though, I've seen some of the more hysterical claims made by the Shadow Minister for Planning in this state, Brad Hazzard. you might say hazard by name and hazard by nature. It's simply scaremongering, the type of claims that he's making. What we need to do, consider a range of possibility. Compulsory acquisition might be part of the future. We won't rule that in or out, but it would have to be done with appropriate guidelines, appropriately safeguards, appropriate rules around it.
Premier, thanks for your time.
Thank you.